All right, it looks like we're getting pretty close to our expected attendee numbers. So thank you everyone for joining us this morning. My name is Abby Hughes, Project Manager with Nonprofit Association of the Midlands. We're excited to have you join us for part of our Just in Time series and our first of 3 panels with VGA. NAM has been working to make sure that our members have just-in-time information during the pandemic. We're thrilled to have Dr. Poor and Dr. Khan join us this morning to discuss COVID-19 with the local nonprofit community. As a graduate of UNMC's College of Public Health, I am extremely excited to have these 2 experts join us and give us advice on how nonprofits can continue to move forward during the pandemic. Just a few Zoom reminders as we get started. We're using Zoom's webinar feature this morning, so your cameras and microphones are automatically turned off. We will have an open question period of the panel. If you'd like to submit a question for that time, please submit it via the Q&A feature on Zoom. If you hover over the bottom of your screen, a toolbar should pop up and you'll see the Q&A button. You can submit your questions there. We will do our best to get to as many questions as possible. This webinar is being recorded and will be shared after with NAM members in the community. I'd now like to turn it over to Beth Kramer with VGA to get us started. Thank you all.
Thank you, Abby. And good morning, everyone, and welcome to the first of 3 panel discussions on COVID-19 brought to you in partnership by Vic Gutman and Associates and the Nonprofit Association of the Midlands. Today's discussion is focused on the pandemic in Omaha, the current state and future possibilities. So I hope you have all logged into the correct webinar. My name is Beth Kramer and I work with VGA. I have more than 20 years experience advising nonprofit organizations of all sizes in planning, fundraising, and management of projects and events. I've also worked with governmental entities at the local, state, and federal levels and numerous political campaigns. I serve as the executive director of Ppes USA, a local nonprofit in Omaha, as well as the finance director and political advisor to Mayor Gene Stothert. We are fortunate today to be joined by Dr. Addie Poor, the director of the Douglas County Health Department, and Dr. Ali Khan, the dean of the College of Public Health at the University of Nebraska Medical Center. A former assistant surgeon general with the U.S. Public Health Service, Dr. Khan's professional career has focused on health security, global health, and emerging infectious diseases. He completed a 23-year career as a senior director at the Centers for Disease Control and Prevention, which he joined as a disease detective and where he led and responded to numerous high-profile domestic and international public health emergencies. Dr. Khan was one of the main architects of the CDC's National Health Security Program and continues this work at UNMC, which has been nationally designated to prepare the American healthcare system to respond to outbreaks of high-hazard pathogens. He also continues to actively support global outbreak responses, such as the response for the West Africa Ebola outbreak in Sierra Leone. We are very fortunate in Omaha to have Dr. Khan here. As Dean of the UNMC College of Public Health, his focus is on health systems and community-based health transformations. Dr. Khan has authored numerous papers and publications and has consulted extensively for multiple U.S. organizations, ministries of health, and the World Health Organization, where he serves on the steering committee for Global Outbreak Alert and Response Network. In addition to serving as the director of the Douglas County Health Department, Dr. Poor is an adjunct professor of the Department of Health Services, Research and Administration at the College of Public Health at UNMC. She has been at the forefront of healthcare in Douglas County for years, but it has achieved notoriety since the outbreak of the coronavirus. She is a recipient of several awards, such as the J.G. Elliott Award given by the university to an individual for advancing healthcare throughout Nebraska. Dr. Poor is on several local boards, such as the Women's Fund's Adolescent Health Advisory Board, Wellbeing Partners, and the Creighton Center for Promoting Health and Health Equity, just to name a few. Dr. Poor is a community investment reviewer for United Way, and her passion is to make Douglas County a healthier community by promoting health equity, eliminating health disparities, and providing opportunities for all to live a healthy life. As Abby mentioned, we have asked Dr. Poor and Dr. Khan to give an overview of where we are with the COVID-19 pandemic. Once they have both completed their presentations, there will be opportunities for you to ask questions through the Q&A button at the bottom of your screen. Now, with those introductions, I would like to invite Dr. Khan as our first presenter.
Good morning, everybody, and thank you very much. Thank you, Beth. That was way too generous of an introduction. I think you took over half of the time you allotted me for my talk. So I'm a big fan of NAM. Needless to say, a very big fan of Vic Gutman and BGA. They've been great supporters of Tri-Faith for many years, and thank you. Thank you for that. And I will never hesitate for an opportunity to be on a panel with Dr. Adipur. For those of you who are participants, you don't get to see the slice of public health officials at the local, state, national, and global level. I do, but we are very fortunate to have somebody who could be working at the national and global level, and we have her here in Omaha. So thank you, Dr. Poor, to have somebody of your caliber here in Omaha during this time and age. And my final comment to the 74 participants is Abby Hughes is amazing, an MPH student, and we have other MPH students also who need jobs, so find us. All right, let's go to my
Thank you,
screen
Dr.
here.
Khan.
So we are going to talk about, is that going, hopefully everybody sees the screen here. Yes? Okay, so we're going to talk about reopening and the new better normal. And let's be very clear, a lot of this is my personal, I mean, it's evidence-based, but some of it is my personal opinion about what I think are specific criteria for opening and closing, because while general criteria have been defined, specific criteria have not. So I just want to start off at the beginning to let you know that, and please, during the question and answer session, we can discuss that. So what I'd like to do is sort of run you from a global perspective down to the state of Nebraska, and then I will turn over to Dr. Poor, who will then talk about Omaha and what's going on in the Douglas County area. So globally, today is, I believe, the 5th of December. So essentially 5 months ago was when we first heard about this virus coming out of Wuhan. And in that 5 months, for a virus that we knew just caused some sort of respiratory illness with person-to-person spread, maybe associated with some sort of seafood market, we now have 6.5 million cases worldwide and over 300,000 deaths. The disease has come, even though it's a pandemic, I try to remind people that it's actually probably 100,000 different epidemic and outbreaks worldwide. So the disease came in phases. It started in Asia first, moved to Europe, then the States, and now it's in Brazil and Africa. And even with each individual country, so the United States, we do not have one outbreak. We have multiple outbreaks at different levels of evolution going on in different communities. And so I'd like people to understand that as you think about opening and what gets opened when, because the outbreak may be at just a different phase within an individual community. And that's why we trust our local and state health officials and elected officials to help us best understand what makes sense for us. Now, the countries in the early phases of the outbreak, they did their job. They've all flattened the curve. So most of these Asian countries and the European countries, they had their peaks and they've now down to little to no cases. Now, unfortunately, the United States not only failed to have a successful response, but they continued to have difficulty getting us into a state of containment of decreasing cases. So although in the US we peaked back here in early April at 35,000 cases, we continue today, 2 months later, to have 20,000 cases every day in the United States. And let me translate that to you. That means every day in the US, let's say just 1% case fatality, we are minting 200 new death certificates every day in America right now because we've been unable to get this outbreak under control. And let me show it to you in a different perspective. And this is per capita. So this looks at per million people to give you a sense of what's been going on worldwide. And I want to use, it's very busy. So let me just use it to make 3 points. The first point I want to make is even countries like Italy, and I'm sure many of you remember the horrific stories of what was coming out of Italy. This is Italy's outbreak per capita. This is the US's outbreak per million. So now I've sort of taken care of the size of the population, because Italy, I believe, is maybe a fifth or the sixth of the population of the US. So it's unfair to count total numbers. So they had a horrific outbreak like we had a horrific outbreak. But look what Italy did, right? They took those cases down, and they're now less than, I believe Italy is five or six cases per 100,000 right now. Look at the United States. We still are at 65 cases per 100,000. So we have been unable to get our outbreak down. And so that was the first point to make, that all these other countries, and these are countries in earlier waves, and forget about places like, you know, if I put Australia, New Zealand, Taiwan, they're all at 0, right? All these countries have figured out their outbreak. And the last point I wanted to show you is, remember I said after the US came South America, look at Brazil. Right? So Brazil now is essentially doing what we were doing, I guess, 2 months ago, right? So this is sort of that phases of the pandemic. So we think pandemic, but I want people to understand it's a global pandemic with 100,000 different epidemics going on right now. Now, despite the fact that the US has not got its outbreak under control, we have essentially opened up most of the US at this point. Right. And I think that was the reason I was asked to talk to you today, to sort of talk about some of this discrepancy between we're all open, but we're still having 20,000 cases a day in the US at uncontrolled substantial levels compared to many other countries that have figured this out. So let's sort of run through what some of the criteria that have been posed to us by the White House and states and cities to think about, you know, you can open up. And then I'll sort of transition that into some of my thinking for our Q&A session. So what we have been told when you think about the president's 3 phases, for example, is, which is a sort of a 3-phase gated strategy. You wait for 2 weeks of lower cases with some other criteria, 2 weeks of lower cases, 2 weeks of lower cases. And with each gate, you sort of open up more and more. And so those gates of slower cases are associated with making sure you have better health systems, because what got us in trouble with this disease was, and as horrific as the deaths were and the people who are ill, what got us in trouble with this disease is there was no place in the hospital for you anymore, right? And so we need to make sure we have strong health systems. And more importantly, if you take away nothing from me at the end of this call, we need better public health systems, and we need to support our local, state, and national public health systems, because that's what's going to get us out of this outbreak. You know, I have no idea if we're ever going to get a vaccine or whether we're ever going to get a treatment, but I can tell you, and you can see based on the data I just showed you, a strong public health system would get us down to no cases in America. So what are some of these criteria that have been posed? Well, one is, are cases decreasing in most states? And the answer is that actually many states have not seen sustained drops in COVID for over 2 weeks. And these graphs change every day. They're pretty meaningless because they change every day, because from what I've been seeing with 20,000 cases every day is the disease sort of hopscotches all over the US. So right now the hotspots to me are Texas and North Carolina. Are the hotspots. But, you know, a couple of weeks ago is Minnesota and someplace else. So the disease is just sort of hopscotching across the US right now. And I already told you most cases have most states have too many cases per million to be even considered controlled outbreaks at this point, including Nebraska. Our outbreak is not controlled in Nebraska by any set of criteria. Most states still don't have enough testing capacity, but this is good. At least one piece of good news I can give you, and I may have a slide to show this, that the testing capacity is getting better in America currently. And part of the testing capacity, this is a link, because whenever you hear about part of testing capacity, people say they expect you to have less than 5% of your cases positive. So that means you're doing enough tests, but of those tests you're doing, less than 5% are positive, which means that you really have done a good job of getting all your cases down, and you've done a good job of looking for them. So that's why you need to link those two together. Otherwise, a good way to get your cases less than 5% is just don't look for any more, which is the approach the Egyptians have taken many years around cholera. So they don't have cholera because they don't look for cholera. So that's not the approach we take in America, of course, around COVID-19. And this is all good news now, which is that most hospitals at this point would not be overwhelmed by COVID-19. Not all hospitals, most hospitals. Because remember, there are if we have another surge, as we saw in the East Coast with like a New York City surge, it would be very hard for many hospitals to deal with that level of surge. But there's been a lot of work done in the last 5 months around PPE, ventilators, and thinking about healthcare capacity as a whole system instead of one hospital, that we are in a much better position for hospital capacity in the US for additional surges. So there's a composite view, and I want to thank my other student, Amir Abdullah, who put all these slides together. Okay, so you take these six criteria that have been proposed to us to reopen states and say, well, layer them on top of each other, and who's ready to open? Well, the place that's ready to open that isn't opening is New York City. So what does that tell you, right? But here you go. Bottom line is pretty much nobody's ready to open, right? Most meet maybe 4 or 5 of those criteria. You know, you can see where Nebraska is in this, right? Nebraska is not ready. Based on those set of criteria alone, Nebraska would not have opened. Now, again, I want to be respectful, as I said at the beginning of this talk, which is that even in Nebraska, it's not one outbreak, right? It's an outbreak potentially of all 72 counties. And so I respect my state and local health officials to sort of make those individual decisions based on other political factors to say what makes most sense in opening and not opening and when you reopen. So it's not just purely a decision based on how many cases you have. There's all sorts of other factors that our public health colleagues need to take into consideration and our politicians need to take into consideration about whether they open or not. But I have the luxury as a dean of a college of public health sitting in an academic center to tell you whatever I want. So just, you know, with all the caveats around that. This is the data. This is, Abdullah, when was this? I think this is 2 days old maybe now, of data for the state of Nebraska. Now, the great thing is, kudos to the state. You just go to the state Department of Health website and you can get all of the data in terms of the cases. And even more kudos, you'll see in a minute that Dr. Poor actually puts all of her ethnicity data on her slide, on her website. But you'll see here, this is cases. So these are the number of people positive every day in Nebraska. And we've had 15,000 people positive in Nebraska, which essentially makes us the 10th state per capita with cases, because we only have 2 million people. So we are actually one of the hardest hit states in America. Fortunately, not hardest hit by deaths, because many of our cases are among young working people and we've not seen so many deaths yet. But by number of cases, we're actually one of the worst hit states in America. And you'll see here we have consistently, I think it's about 250 cases a day in the US, in Nebraska for the last 2 months or so. Okay, so that's what the situation is in Nebraska. Oh, well, I did have this slide to show you. So this was the sort of the good news slide I wanted to show you about testing. So you'll see in the US, we're testing about 450 people, 450,000 people every day right now. And by the beginning of August, we'll be able to test approximately almost 1 million people every day. And that far exceeds anybody's considerations of how many we need to test. So I think the testing thing is and will resolve itself soon enough. And my guess is we're probably a month away from the resolution I would like to see in terms of number of tests being available to people. So we now need to couple the testing with the public health part of find each case as fast as possible, isolate them, and then as fast as possible, find their contacts, put them in quarantine, and we can get this outbreak under control. So let me transition to the new normal. And I like to talk about, and I don't like new normal, I like better normal, because there's lots of things about the old normal that I didn't like very much. And some of that may be in the protests you see in the streets every day, right? So I want to get us to a better normal, not just in terms of our healthcare system, which is not a healthcare system. It's a patchwork system that denies care to numerous people, even those who may actually have healthcare, right? And you all know the social injustices, social determinants of health, and the health inequities in our system. So I'm looking for a better normal. But where COVID is concerned, these are my personal thoughts now. You know, what is that better normal for COVID? And for me, the better normal is when we have low community transmission, and that would be less than 5 cases per million per day. And this is the level essentially achieved by Germany. And this is not unachievable, right? This is what Germany, China, Vietnam, all of these countries already have this already. This is where all the European countries will hit in the next week or two. So to me, that is the safety place. And did I couple that with? No, I didn't. Usually I couple this with vulnerable populations. I'm always asked, you know, so I have a 93-year-old godmom who lives right here in Ponca Hills. I do all her shopping for her. Right, and I will feel a lot more comfortable letting her go out, you know, out to the Hy-Vee down the block when community transmission gets lower. Right, I would not be comfortable, and I'm not comfortable with her going out and doing her shopping now. Well, and to make this happen, we need to make sure we as a community support our public health system. So we have a personal responsibility, masks, social distancing, and hand washing. That's our personal responsibility. But I think we have a responsibility to hold our elected officials responsible and say, get cases down in our community, because that's the way we're going to be safe when we get out. And then the second question I know NAM's very interested in is, when can we start some of these mass gatherings that people want? And again, this is a disconnect. The city and state will tell you, yes, 25, 50, 100 people to start having these mass gatherings. This is my sense that probably when you get down to moderate controlled disease within the community, so 5 to 25 cases per million per day, I think about then is when I personally would say, yeah, I think you can start putting lots more people together than just the going out to the store part. But again, personal opinion. I am now going to turn over to Dr. Poor to give you the Omaha view. Dr. Poor, all yours. And I can advance the slides for you, Dr. Poor, if you would like.
Okay. Good morning, everyone. And I'm not going to spend a lot of time, but I want to thank all of you this morning to be on the call. Many of you are our partners in this community to make this community healthy, vibrant, and so on. I want to thank Dr. Khan. You know, he's very generous in saying he's happy to have me here, but actually it's the other way around. I remember when we were in discussion to bring him to Omaha, I said, and how can we keep him here? So I'm really happy that you are still here, and I will try everything in the world to keep you here, Dr. Khan. So thanks a lot, and thank you all for coming here. So I want to talk a little bit, you heard from Dr. Khan, but nationwide, globally, what are we seeing in kind of this 30,000 foot level? I want to bring it down a little bit local. This is the dashboard that you see from the Douglas County Health Department every day. This dashboard is being brought up with new data around noon every day. So let me just share with you a little bit at this time. This actually is, I think, the dashboard from a day before. So up to this morning, we are at 4,865 cases. But we have also done 35,728 tests. That's 6.2% of our population in Douglas County has been tested at this time. We have a positivity rate yesterday of 15% and a total rate for the last week of 13.5%. And we are looking at the positivity rate very carefully on a daily basis. But let me start out first with probably, to me, always the hardest information to give, and that is our death rate. We, as of yesterday, reported 45 deaths in Douglas County. We reported 3 new deaths yesterday and 3 deaths the day before. The day before actually was the first time we reported a person 100 years of age that died from COVID-related diseases. When you look at our race and ethnicity in our individuals who died potentially from COVID, we are seeing 60% of them are white, 16% are Hispanic, 18% are African American, and 7% Asian. When we look at the age range, as you would expect, but I just think we need to know, 76% are above 65 years of age, and 16% are between 50 to 64 years of age. And over the last few days, when I follow this data really closely, I see an actual increase in the median age range in that 50 to 64 years old. And I think that is significant, and we need to look at that. Let's now go from that, let's go to cases. And when we look at cases, who is really affected by this disease? We can see, of course, no surprise to any of us, 50% of them are in the 25 to 49 years old. When I talk about cluster later on, I think it becomes very clear to you why that is such a large proportion. However, there too, I am starting to see a change, and the change is in the younger age groups, 5 to 24 years of age. We now are seeing 18% of our cases in that age group, whereby 10 days ago, I used to be saying 14%. So we are seeing younger cases now. And I think with all the unrest that we have seen and the protests, that number, that percentage may actually increase in that age group. We see only 10% of our cases in those 65 years and older. When we look at race and ethnicity, and there is a lot of discussion on the national level, we were pretty transparent, and I always want to be transparent with our data, that we looked at race and ethnicity from the beginning. What does this data tell us? Because only then can we actually put resources in where resources are needed. But I'm also getting some criticism. I tell you, you can never do it right for everyone. So I have really become very, very passionate about this because people will tell me, yeah, you are stigmatizing individuals who are at higher risk. No, I'm not. I'm trying to point out where the risk is and where therefore we as a community need to come together and put the resources towards it. So when we look at race and ethnicity, it's not a good picture for our community, but also we are not different than many big urban areas. What we are seeing is that the highest percentage of our cases are in our Hispanic population. And that percentage has really increased. And has increased just again in the last 10 days. 52% of our cases are in our Hispanic population. 13% in our Asian population, and that includes our immigrant population. And that percentage has actually decreased over the last few days. We are seeing 8% in our African American population. That percentage is decreasing from 12% to now 8%. I get a lot of the question there. What is that? Why is that due? Is that due that African Americans are getting tested less? They have less opportunities to get tested? No, they have opportunities to get tested. Charles Drew has, from the beginning, we have provided test kits for them. We have opened the criteria in that community. NOAA in North Omaha, they also are now going to have a drive-through testing site. So it's not that, it's probably that we more need to get the awareness out to that community that testing is available and is important. And you see our white population at 18%. That is actually increasing too slightly over the last few days. And so we are looking at that carefully. You're seeing there the recovered, 1,101 are recovered. What that means is that we have staff that is designated to call individuals back potentially 3 weeks after they have been identified as positive and ask them the question, have those symptoms really, have you really recovered and those symptoms have gone away? And if they say yes, they have, they then are counted as a recovered. If some of them are saying, you know, I still have symptoms that seem to be lingering, then that is not a recovered individual. So that is a national discussion. Again, there really isn't a very accurate case definition on recovered. I think Douglas County is using that definition by calling them back, and Lincoln Lancaster has now adopted that case definition too. We have it by age, and we have it also by race, those that are recovered. And of course, that isn't much different as what our cases show. So you can see there, most of our cases are now that are recovered are Hispanics, then white, and then Asian percentage. I want to talk a little bit to you about other things. So if I want to share with you one thing, I think if you are interested where our case rate is in Douglas County, go to this map to really learn from it. You can look at it by zip code. It tells you how many tests have been done in each of the zip code. Doesn't tell you their race and ethnicity, but well, it does, I guess. No, that is the underlying race and ethnicity in each of the areas. So in Douglas County, we often use zip codes as a surrogate for race and ethnicity. So when you are looking at some of the zip codes in North Omaha or in South Omaha, we know that those are areas that are mainly populated by our minority population. And as you can see also on this slide. So this is really good information for you to use. What is interesting to me, and I don't want to spend too much time, but Test Nebraska is this new endeavor that the state has supported and is in Omaha since the beginning. They have a permanent site at CHI, and you have to complete an assessment. Does not seem to be very user-friendly for our minority population because you need to have an email address and so on. So Test Nebraska, when I look at their data, is really out more in the western part of our county. That's where the testing is occurring. But let me share with you some other things. I look at very carefully, when we look at our cases, what does it mean for clusters? Where do we have clusters, and are clusters making up most of our data? So at this time from our data, we have 111 clusters in Douglas County with a total case count of 1,698. So 35% of our total cases are these clusters. So you may ask, so what are those clusters? 21 of them are clusters in food processing companies. They make up 30% of our clusters. 14% are in our long-term care facilities. Those make up 5 to 6% of our total cases. And then the next categories are really small. They are small clusters with 2 to 3 individuals. They are like general construction companies. They are food handlers within restaurants or within bakeries, for example. They are general manufacturing, but those are very small, 2 to 3 people. But the big clusters are food processing plants, long-term care facility. And I think that is important for you all to know. So let me talk quickly about hospital resources, and Dr. Khan addressed it a little bit. We look at that data very closely every day. And thank you, Abby, for bringing up this slide. This is a slide that comes out of the Global Center for Health Security and looks at data on a regular basis. Some of it is looked at by Health Care Coalition, and that is not really important for you to know, but this is really where we are looking at hospital bed, ICU bed, ventilator use. And what you see is you see a certain number of benchmarks that are being established there. These benchmarks have been established based on national recommendation, CDC recommendation, confirmed case indexes are recommendation by how do we eliminate certain diseases. Positive test index has 5%, has been established, has been recommended by disease experts at the University of Nebraska Medicine. And so every day then the Global Center actually evaluates this, and they do it specifically once a week also for each county health department. So you can actually see it, and this one is specifically for Douglas County Health Department. So our index is, and a little bit as Dr. Khan talked to you about, it's 9 cases per million people. So what does that per day? What does that mean for us? It would mean 5.5 new cases per day for Douglas County. We are at 159 cases. So you can see we are far away from actually reaching that index. You look at positivity rate, percentage-wise, sometimes 10% is used as a threshold. 5% is, of course, a better measure. We are at 18% for this week. Confirmed death index, so that's why we are in red. We are not achieving that measure. Confirmed death index 0.14, we are at 0.3, still we are higher than what the index is. But what you see there is then the next 3 measures. They are hospital beds. How do we do in regards to capacity? And this is what the governor always says. We wanted to flatten the curve from the beginning, not to overwhelm hospital systems, not that what we have seen in Italy and so on. So we looked at this carefully, and why you see it green is our hospitals have the capacity in regards to bed, in regards to ICU beds and ventilators. Our ventilators use, as I just looked at it yesterday, is at 42% of the total number of ventilators that we have in Douglas County, and only 46 of those 360 ventilators, 46 of them are used by COVID patients. So yes, you are seeing the capacity of taking care of individuals in our community is here. So the next 4 measures are really trying to look at some indexes and some ratios, and it's probably a little bit more statistically not so significant for you. The other thing is on the line 2 and 3 is the velocity and how quickly are we accelerating. I guess I would tell you not so important for the pram velocity and pram acceleration, not so important for you to look at, but for us who are looking at these things instantly, it is something. And this is also, I want to share with you, this is what the chamber is looking at. The chamber is especially looking at confirmed case index and percent positivity rate. Those 2 measures, they have really shared with their memberships and are looking at that as a measure. So this is being looked at them. So let me switch and talk a little bit about reopening. So reopening is going to be in different phases. So I want to talk to you just quickly about reopening in long-term care facilities, what they are doing. They have an edict now from CMS to actually put some plans together. So for that, those reopening plans to happen and to be for them to do them, they actually need to do more testing. And so over the next month, over this month, actually, they are going to do testing in long-term care and assisted living facility in Douglas County and Lancaster County, because those are the 2 counties that have been prioritized for the state of Nebraska. So if a long-term care facility has had cases, they are going to test all of the residents and all of the staff in that facility to kind of get a baseline so that they can develop a reopening plan. If they are a facility who has not had a case, they're going to test all the staff in that facility. If all the staff is negative, then that facility can go forward and develop a reopening plan. If there are some staff that are positive, then they actually need to go in and do more testing. So long-term care and assisted living, if you think about those populations, they are very static. So that's why testing is really beneficial in those facilities. Let me talk about what schools are doing quickly. So you have kind of an overview how every organization or sector of organization is looking at this different. Schools are looking at this very carefully now. We have meetings with superintendents on a weekly basis myself now. We are starting to talk about different scenarios. What would a scenario look like if they still need to do long distance schooling? So that is one. Phase two would be, what is a school environment going to look like if we have a mixed environment? We have some home-based schooling and long-distance schooling, but some students could come back to work and to school, and we call that 50% school. We also have 100% school environment. What would it look like if we are bringing 100% of the students back? And so this is really now being worked through, because if they are planning to have any opening in fall, they need to start purchasing PPE at this time and really start to make lists, see how would we communicate to parents? How do we communicate to teachers and to students? What education do we need to have in place? What environmental factors do we need to consider? So that is signage and so on. That is starting as we speak, because from the state perspective, the state education commissioner is really only developing guidance. And he's saying, you local schools, you make your own determinations what you need to do and want to do. So let me go now to the direct health measures that are applicable to Douglas County. I think all of you are probably aware about the youth sports that now can start, especially if they are softball, baseball, they can start training on June 1, and then potentially games can start on June 18th. You know about the religious services and what are some of the social distancing that they have to follow. Bar, restaurants can open now, 50% of their occupancy, but very strict guidelines that are being put together by the Nebraska Restaurant Association. Those guidelines are all on our website and people can look at them. Daycares, we are still at 15 students in a daycare setting. However, they have increased it to 20 students for school-aged children. Hairstylists, all hair salons, those things, 50% occupancy rate, and they are the only organizations and businesses who have to wear masks. They are required to wear masks by staff as well as clients, and if they don't, that is enforceable under the DHM. You heard about fitness clubs, gyms, and so on. They are 25 persons or 50% of their occupancy. I want to go to a little bit something that is more difficult to understand, and that are gatherings. Gatherings at this time are restricted to 25 people or 25% of the rated occupancy. So what does that mean? So if a business or a conference center has an occupancy of 1,000 individuals, they can only have an event at that venue at 250. So 25% of the occupancy that is rated for. 25 people or 25%. That is different from all the other events and cases that I talked to you now about restaurants where it is 50% of occupancy. Gatherings, events, 25% of occupancy. That includes indoor events and outdoor events. That still includes groups of 6, includes social distancing, 6 feet apart if possible. And it has another wrinkle in it, that if an event is being held that is in one of these facilities that has a rated occupancy of 1,000 individuals, you have to develop a plan. And that plan has to be presented to the local health department and has to be signed off by the local health department. So we have started to develop templates, and it should be, I hope by Monday we'll have everything ready to be up on our website. We actually thought it may be the easiest for you to have templates that you then can fill in and tell us, because now there are some certain things that you need to think about if you are planning to have events in bigger settings. You need to tell us about the number of guests. You need to tell us how you are going to do social distancing. You need to talk about sanitation. How would you sanitize? How do you have hand washing available? How do you do the cleaning? How do you do it on a regular basis, evenings only, or do you do it during the day? You need to talk to share with us, how would you protect your staff who is there at these events? Do they have to wear masks? Do people who come to this event need to wear masks? Do you do temperature checks? Do you do symptoms checks? Those are all. How would you take care of vulnerable people who come to these events, or can they go to these events? Do you serve food? Do you serve, and what are you going to do to make sure that you do not have ill or sick attendees at these events? So I think for you all, that is something to think about, and we can talk about it. And if you have questions, like I said, we will put up these guidelines on our website so you can go in and complete them. We have an entire team now who is reviewing these type of plans when they come in, trying to turn them around as quickly as possible. Remember, this is the DHM for the month of June. We don't know yet how this is going to start looking in July, because there is a lot of pressure on the governor now to start to look further ahead. What else could we actually lift up? And the discussions are just starting now. We are in those discussions all the time, public health is, but remember, there are many voices in those discussions. And as a governor, you are not only looking at the public health perspective, you are looking at the economy. He needs to look at some of the businesses and the income that's coming into it. So what you are hearing today are really the voices from public health. I have to tell you, I am very impressed with the chamber, who is really incorporating public health very much so in their facing how they want to be open. And he's starting to talk about different phases, and they have 3 phases set up, and I just thought I'd mention it very quickly to you. Phase 1 is really, they would still have groups of 10, and most of the individuals would work from home. They also have under phase 1 really strict travel restrictions. That's another thing, however, that is in this DHM. It's been lifted in this DHM. The only travel restrictions are if you travel internationally and come back to Nebraska, you need to quarantine for 2 weeks. That doesn't affect any travel that you do from state to state or so on. They have phase 2, which probably is for them the phase that they are in right now. That is the phase where they are still very considerate about vulnerable population, that may not be the population to bring back to work. How can you do social distancing at the workplace? A lot of these are decisions that individual organizations need to make. Like I have made a decision in our department. We are work a lot, more than 50% of our staff is working from home. And I have made the decision a week ago that we are still going to go this through June, because it has worked for us. And it would only be if it wouldn't work that we will bring people back to work. With the infection rate that we are seeing in our community, it just isn't safe. I'm very concerned about the protests that we are seeing at this time. If we are seeing even a further increase. And then what the chamber has in phase 3, I think what we all are hoping for is that we are going to have a vaccine available or a potential treatment. So with that, I'm closing, Abby, and I think we are ready for some questions from this audience.
Fantastic. Thank you so much, Dr. Poor and Khan, for your time. That was incredibly insightful and I think helpful for everybody involved. I just want to ask, with the reopening of the businesses nationwide, and Dr. Khan, you did refer to this, but and the protests that are happening, we're obviously not out of the woods yet, and it's a balancing act between public health and economic recovery. I saw the news this morning that the CDC is concerned, as are you, about an increase in cases or a second wave in cases due to the protests. Does that still take into consideration? I know the second wave of cases was to be this fall, and schools are making arrangements based on that second fall wave of cases. Does that mean that we're actually looking at a second wave here in June and a third wave in the fall? And if so, at what point are we asked to quarantine or shut down again?
Is that a question for me, Beth?
Yes, if you could talk from Douglas County perspective.
So the first thing I want to say, we are not in phase 2. We are in phase 1 at this time, and we are still seeing cases. We are not flattening out. Even so, you know, every week I'm thinking potentially next week we are flattening out, and we are seeing more opportunities for testing. So we are not flattening out. And I think what you are seeing from some of the protests potentially, you are seeing just an increase in our community. We have not gone down, which is different from other communities who may have seen a downturn. So I would say I'm still talking about a second wave potentially when influenza comes this fall. So I would not talk about 3 waves in Nebraska, specifically in Douglas County. That is completely different in some of the rural areas of Nebraska, where they have no cases. They have had no cases for a week or so. But in our community, we are still in the first phase. And what is happening or what potentially could happen with this, I would still foresee we are seeing those cases. Dr. Khan.
So I tell people who are worried about the second or third wave, we haven't figured out how to surf the first wave. As you see, if you look at cases in Omaha, they're continuing to go up. If you look at cases in the state of Nebraska, I mean, we have uncontrolled substantial transmission within our state. So we've not taken care of disease within our state, let alone, you know, how more uncontrolled you want it to get when you talk about a second or third wave, and we're still opening up despite the uncontrolled state. I do want to make a comment, if I may, Beth, which is, I don't think there's a dichotomy between economy and public health. I mean, and I showed you examples at the beginning of this talk of all these countries that have been able to open up and get their cases to 0. So I really think it's about a commitment to say that we are going to support our local public health department, get them every contact tracer they want, get them every epidemiologist they want, get them every dollar they want, so they can drive down cases within the community. And at the end of the day, if I had a choice between 5 cases in my community and 1 million masks, I'd pick the 5 cases in my community to protect my grandmother.
Thank you. This is a question from Kim at CASA. We utilize volunteers to advocate for children in the foster care system. As social distancing guidelines relax, we are hopeful to see children in person. History shows that incidents of child abuse are likely to increase during times of social isolation. If the volunteer and child follow social distancing guidelines, wear masks and sanitize hands, Would you recommend visitations? I think that's probably a question for Dr. Poor.
Yeah, that is a good question, and we are worried about some of the negative results that have come out from. So I would say if you can do social distancing with children in small groups, potentially one-to-one, I think you can do it. But I would encourage all, hand washing, wearing masks, be 6 feet apart, and in this weather, even choose outside, because we do know that it outside or inside does make a difference. So I do think we need to start having these interactions if we can have them safe.
And kind of related to that, Dr. Khan, have we had any cases of the post-COVID-19 related syndrome seen in children here in our community?
I think actually Dr. Poor would be the best one to know, because she's responsible for surveillance, but I have not heard of a case yet in our community. Dr. Poor, have we had surveillance reports of a multi-inflammatory syndrome case in children yet?
I talked to a pediatrician the other day who says they are investigating if there is one. Yep.
And I will be honest, I don't know which of you this would be better directed at, but can we discuss the mental health and economic consequences of prolonged closure and stringent regulations? When calculating the levels of health risk that we are willing to take, shouldn't this be part of the conversation? And I know the mental health aspect is near and dear to my heart, but I know that there's a lot of the nonprofits that are concerned about that as well.
I think Dr. Poor answered it when she said there's lots of considerations that need to be taken in when you think about reopening and when you reopen. And absolutely that included the economic consequences, that includes mental health. We just talked about potential child abuse. So I think that's all considered. But again, I think this goes back to this false dichotomy that people think either we have lots of people dying from COVID and we have to open up. And I think this is a false dichotomy that is being forced on us by elected leaders who don't want to make the hard decisions to drop cases within our community. So I'll just say it that way.
Are either of you aware of any plans to speed up production of test results? It seems the delay between swab and results reporting is long enough to distort data conclusions.
It's all a matter of the laboratories. There are so many laboratories involved in the testing. So just think about it. You go and get swabbed at a drive-through. So then they are waiting, these samples are weighted and then are being brought back to the laboratory. Now, Test Nebraska is using a laboratory in Lincoln. So that needs to be transported back to that lab. Then the laboratory runs samples in batches if they can, but sometimes, so they only have certain times of the day when they have that run. And I know for a fact that, if you're being tested 5 minutes later than the laboratory is doing a run, you may need to wait till the next day. And then when the data comes in from the laboratory, it goes into a database. And then from there, it goes into another local database from the county. So it can take a long time. I have had now and have heard some good examples of Test Nebraska who actually is informing you when you are being tested. Of course, you know that when the sample is being transported to the lab, they inform you and say your sample has now been transferred to the laboratory. And then about 24 hours later, you get the results on your iPhone. There were some difficulties in the beginning, as with any new system, but I think they have worked those out. So for Test Nebraska, it is going pretty quickly. Some of the other laboratories are private laboratories, LabCorp, Quest. Some of them are out of state. It may take a little bit longer to get results back.
Thank you. And Dr. Poor, this is for you as well. Does the Douglas County Health Department provide PPEs to nonprofits? I understand one of the nonprofits has applied twice, but doesn't understand what the process is. If you could just
Yeah. So PPE, decided early on that PPE would be ordered centrally from the state. So HHS, Health and Human Services, has actually ordered PPE for all of Nebraskans. And that those orders then were provided to the local health departments, who are giving it out to organizations who said they needed it. Now, the criteria was pretty strict in the beginning, because there was a lot of controversy about we didn't get the right material. There were false masks that were being sent. So really, we wanted to make sure that healthcare providers and those that take care of COVID patients had PPE. That was the criteria that was developed, because it is purchased with state funds. So now it has opened up a little bit. I just have heard actually today that there are some masks that the state has, and they are wondering if we want some more, just to give to organizations like you are talking about. So I think that is opening up a little bit.
Thank you. Someone asked that 5 to 24 years is a broad range. A lot of our nonprofits are focused on the elementary school children. Do you have statistics specific to school-age children? I know a lot of our nonprofits are wanting to open up, and you've alluded to this, for their summer camps, their classes with dancing and singing. And do you have something that is more specific to that 5 to 12 or 5 to 18 age group?
Good question. And, I just have actually my data analysts today look at it, because I do think we need to show it to you in smaller increments. So we should be able to get that data, and we'll put it out on the dashboard.
Thank you. Let's see, do we have any other questions? One question is, why are we talking so much about reopening if we are not flattening out? Dr. Khan, I think you've addressed this a little bit, but if there's anything else that might clarify that.
Again, it's because reopening is not linked to just the number of cases within the community. There's other factors that political leaders have to take into consideration as they decide what to do within their communities. But I want to remind, if I haven't said it, I think I've said it twice, maybe I'll say it thrice. I think this is a false dichotomy. And I think it's incumbent upon citizens in America to hold their elected leaders accountable and say, I want to go out in my community, and I want you to make sure you're supporting public health so I can go out in my community safely. Like so many other countries, and it's like so many other countries have done it already. It's not like we're asking them to do something that other people haven't already figured out how to do.
Right. Thank you very much. Do we have enough contact tracers in Douglas County, Dr. Poor, or in Nebraska all as a whole? And is there anything that, a lot of our nonprofits work with these populations that are hardest hit, such as the Hispanic population? Can the nonprofits be helpful in that contact tracing?
So we have now internally about 30 contact tracers, but we also have 2 teams out of HHS with another 30 on each team. And those teams get together. Contact tracing requires some training. As Dr. Khan probably would tell you, it's not just something that anybody can do. So we have trained, and we actually had to let some people go because they just didn't work out on it. The governor has this goal that we have 1,000 contact tracers in Nebraska. Those are numbers. It depends on the quality of those contact tracers, because it is really building a relationship with that person who you have on the phone. You are just telling them now that they are positive for COVID-19. And I want to share with the group what you all in the nonprofit world would appreciate is we have a team the contact tracer contacts these individuals and have a call. Sometimes it's 2 hours, 3 hours, a lot of Spanish speaking at this time. But there is a question or several questions that we ask. Are there some specific needs now that you know that you have to isolate because you have COVID positive? Are there needs that you have? And so we have a team, a community health worker team that then contacts these individuals and say, and what can we do for you? So we have a relationship with the food bank, with No More Empty Pots, with Whispering Roots, that they actually provide them food boxes that will be delivered directly to their home, so they don't have to leave their house, because if they are isolated or even quarantined, we want them to stay put at that. We also, I can tell you, so food insecurity is the #1 issue that these individuals face. The #2 issue is utility, paying for utilities. So we are always reaching out to resources in our community to see where can we refer those individuals to. And #3 is housing. Housing is becoming more important now. I just heard from the shelters yesterday who are seeing more people in the shelters, because now the eviction notices are being lifted and people can put those in place again. So, community members or nonprofits that are sitting at this table today, they actually can help us, really being partners with us in trying to make sure that we put our arms around those individuals who are affected by this. Contact tracing, if anybody is interested, we are now looking not only for contact trace, our information line. We are celebrating today the 10,000th call. We had information line open since the beginning of March 1st, and we now have received 10,000 calls. Just yesterday, we received more than 70% of our calls were Spanish. In the beginning, the calls were very much, what is the disease? What are the symptoms? What should I look for? Then the DHMs went in place and businesses were calling and asking questions. But now it is mainly from the Hispanic population. Where are my results? What do they mean? What do I need to do? And so on. So, and I need a letter that I have been tested. I need a letter that I can go back to my work job. My employer wants to know that I have been tested. And so we are developing a lot of those. In regards to PPE, I just want to share with you, we have distributed more than 1.5 million pieces of PPE in Douglas County to more than 500 different facilities. So we have really tried, we have become a distribution team also, those are things that nobody really thinks about that the health department is doing. But I just want to share, and we can use all the help and assistance from everyone. I also would like to say, we had great cooperation from some of our foundation and philanthropic groups to actually provide us masks. So we could give masks out much free, especially the cloth covering, not the medical masks. So we now gave some to OPD. So when these protests are, that they can give out masks to protesters and so on. So we are really trying to address it from all sides.
Wonderful, thank you very much. Something that all of the nonprofits are looking at is reopening. And I know that you went through some of the benchmarks, 25 people, 25%, those types of items for June. I know that you mentioned opening, you're now looking to consider openings in July and what those would look like. A lot of our nonprofits have events coming up in the fall and wondering, when they need to make a decision on having an event in October or November. One of the things, if they have specific questions as we go through the next 4 to 8 weeks, we will post on the chat, and it was also one of the screens that will be shown and shared with everybody. But if there's a specific question, who should they call, or where can they get information specific to holding that event or to reopening their office? Where should they go?
You know, the best thing is, first of all, go on our website and look at the guidance documents. But if they have specific questions, I probably would say call our information line. There are good people on there that have a lot of information, or at least could forward you to somebody specifically. So 444-3400 is our information line.
And Abby will post that in the chat also, just so that everybody has that phone number. Thank you very much, because I think there'll be questions moving forward. Dr. Khan, are we consulting? I mean, you've referred a couple times to other countries and how they have reduced the curve. Are we consulting at all with those countries in looking to see what they have done to drastically reduce their curves?
Yes, and I have a weekly call with the group of global experts that talks about the exact same issue, and we have a 3-day conference call, a global conference call next week, looking at contact tracing. So yeah, and it's not just me. I mean, Dr. Poor, the CDC, others, we know what other countries are doing. This isn't a secret.
Fantastic. It is 9:42. I think we're going to have to probably wrap it up. If people have questions, is there a way that they can email us and we can forward to the two of you for specific answers, or is it, you know, in the event without them calling your office directly, just kind of as a result of this webinar, there might be some questions that in an hour later that they might think of. If you're amenable to that, we would just forward to you. And so I would say to anybody, I apologize. The dangers of working from home, right? If anyone does have a question, I would be happy to forward it to the two of you, and we will get those answers back to the folks who participated. I want to thank both of you so very much. This has been incredibly helpful for the nonprofits. We've had a fantastic number of people participate, and your time today has been invaluable for all of us. So thank you so very, very much on behalf of the Nonprofit Association of Midlands and VGA both.
Thank you, everybody. Have a great and safe weekend. And if you want to hear me and others talk about a little social justice, there's a Black Lives Matter protest in Memorial Park at 1 o'clock.
Great. I just want to say have a safe weekend too, and you know, let's work together all. Thanks.
Thank you so much.
Thank you all for joining. NAM will be sending out the recording of the session after. And as I mentioned in the beginning, we have 2 more panels coming up with VGA, so keep an eye on NAM's calendar and register for those there. Thank you all.